Warning, this one is pretty graphic. Susan had a previous lip lift with her previous doctor, so we didn't need to do that. She also had a chin implant and upper eyelids. She came to see me from Texas to finish the job. So she wanted a brow lift, lower face neck lift, deep plane extended face, deep neck, some fat transfer, and some earlobe reductions to kind of balance everything out. The brow lift I chose for her is called a gliding brow lift. You have not seen this yet on my page. It is a very specialized way to do a brow lift. It's minimally invasive. It doesn't require any drains. It allows me really fine control of the brow. I like it in really thin-skinned patients like Susan, which you're about to see. What's weird about it, and might be spooky, is that for 48 hours, I have what I call Spider-Man sutures. It looks like netting on the surface of the skin. That stays on there 48 hours. We remove those stitches 2 days after surgery. They leave no marks, but they're the magic that allows this lift to work. Anyway, I hope you enjoy the video. Let me know in the comments below. Second day post-op today with Susan. How you feeling?
Great, really. So far, no pain medication, just Tylenol, sleeping pretty good, and nope, everything's great so far.
Good.
No complaints, surprisingly. It's been awful. I mean, awesome.
Awesome,
yeah.
awesome. So Susan, that's okay. So Susan had a deep neck lift, deep plane facelift. She had previously had a lip lift, so we didn't need to do anything there. And I did a special kind of brow lift on her. It's called a gliding brow lift. And that's what these interesting kind of Spider-Man stitches, bag of avocados stitches look like. So I'm gonna have you turn towards me. And I did earlobe reductions. Thank you, Kelly. I also did earlobe reductions. So, and that's gonna be critical for getting just this really pretty jawline and neckline together. So she's swollen as would be expected. She's swollen a little more around the outer halo because that's where one area where we had to build a little bit. She was a little bit high, tight, and narrow in the jawline. And so when she's settled, she'll have a beautiful, strong jawline, not a high, tight, narrow jawline. But this is called a gliding brow lift, and it's done through an incision that's not even a centimeter long. And we reposition the skin, and we tack it there with these sutures that last 48 hours. So these sutures are gonna come out this morning because it's the second day after surgery. They don't leave a mark at all.
Wow.
And turn this way again. And the big thing with her is she had a significant skin excess right here underneath this brow. Do you remember that?
I do.
Yeah. And we do a really nice facelift. It actually bunches the skin even worse there. So I need to capture that with a brow lift. And it's someone with thinner skin that already has significant skin excess. Sometimes I prefer this specific kind of brow lift because I think it does a better job of capturing the skin layer. So you look absolutely perfect. So
thank you.
Turn towards me one more time. So her jawline is exactly what we expect, her neckline is exactly what we expect. You might notice that we see this drain more prominently. Turn back, turn all the way around. And we don't see it as much on the other side. It's because they go to different layers of the neck, and for the same reason, they usually collect different amounts of fluid. So turn back this way. The first night, did that catch your attention?
It did, yeah. I noticed it right away. But it's not painful.
Yeah.
It's not painful at all.
You're not even moving.
You see it, but it doesn't bother you.
Yeah.
No.
And so that's a question I commonly get the first night is I see one drain more than the other, or that the bulbs are putting at different amounts. And this explains why. One is in one place, one's in a different place. Actually, let's do that. Turn back towards me here. Face me. And I want you to tip your chin slowly down. And her jawline and neckline are going to be dead on. Tip your chin back out for me. I mean, that looks just outstanding. Good. Turn that direction.
Beautiful.
So you took Tylenol, no pain pills.
Nope.
Did you have any nausea?
Nope, not at all.
Have you had nausea with previous surgery?
Nope.
Never, not prone to it. That's good. Anything else you want to let them know for day 2?
No, it's just been better than I even imagined. And I've been watching Instagram thinking, let me prepare myself. And then you come and you go through it, and it's just like so much easier than you can ever imagine.
Well, not for everybody. Has been for
not
her.
For
Someone's
me,
going to watch this when they're feeling all beaten up.
It's been really great.
Yeah.
I can't complain at all.
Well, thank you for letting people follow your recovery journey. This is going to help a lot of people.
Thank you.